Yes. So, Holly, what brings you in here today?
Well, I'm a little concerned because my brother has what might be Marfan Syndrome. And when I Googled it, I thought that maybe I had some of the characteristics, but I really don't know that much about it. But I'm a little worried because my brother ended up having to have heart surgery a couple years ago. So
you're worried about that?
Yeah.
Yeah. And so we've done your family history, and you said that you also have some aunts and uncles on your mother's side who have had some heart issues as well.
Yeah, I'm not sure exactly how we're related. I think it might be my mom's cousins. But they've had heart issues in the past, and I think two of them died from what I think were heart attacks.
So you're concerned right now about figuring out if you maybe have a heart condition as well.
Yes.
Okay. So do you want to understand what Marfan Syndrome is a little bit?
Yeah.
Yeah?
Yeah.
Well, it's a connective tissue disorder, and there's a lot of different words that you could use to describe it, but I don't know if you understand what fibrillin is?
No.
Okay, well, it's kind of the elastic part that makes it so that your joints can move, but also keep its strength. And so in Marfan syndrome, what happens is you don't really have that. So over time, different parts of your body that have a lot of connective tissue just kind of get loose, and they don't have the same strength as other people. So
is that what makes the heart a problem?
Yeah.
Is there that in the heart?
There's a lot of connective tissue in the heart. And
okay.
So over time, with one of the main parts of Marfan syndrome with cardiac disorders is aortic enlargement, that over time it just keeps getting bigger and stretched out. That's what he had? Okay.
Yeah.
All right, so I'm going to write that down. Okay, so do you have any other questions?
What is the likelihood that I could pass it on to future children if I do have Marfan's?
Well, if you do have Marfan syndrome, it's an autosomal dominant disorder, which means that if your mom has it and it's passed on to you, and you have one gene for it, and whoever you marry or have a kid with doesn't have it, that your children have a 50% chance of getting that one gene from you. So if you have any children, they each have a chance of 50% of having that. That's why it's really important to figure out if Marfan syndrome runs in your family early so that you can have some early intervention strategies.
Okay, and what would those strategies be?
Well, there's no cure for Marfan syndrome. So it's really about treating the different conditions that you view over time. So, like your brother had heart surgery. If he does have Marfan syndrome, then what you should be doing is, having an annual check of, organs that you really need, like your heart and your eyes. And, yeah.
Okay. So maybe I should get my heart looked at?
Yeah, I think that we could set you up with a genetic counselor and really figure out if that would be right for you. And do you know if anyone else in your family would be willing to come in and meet with a genetic counselor?
Well, I could probably convince my brother to come. I'm not sure, though, because he's a little sensitive about it.
Right.
I think my sister would probably come in, too. Because we've talked about it, and we're both a little concerned.
Right. So when you get genetic testing for Marfan syndrome, where the mutation, occurs and the change happens, it's a really big space. So there could be a number of different types of things that could happen, and it's really hard to zero in on that one if you don't know what the mutation is. So it would be really helpful if your brother could come in as well, and then all three of you having genetic testing would definitely make it worth it to find, that mutation.
So it might not be Marfan syndrome. It could be something else.
It could be. There's a lot of different disorders that kind of affect the same organs and similarly, and it might look the same as Marfan syndrome. So, and some of those occur in different places on your body. So, you might not be able to find, the mutation because it could be one of the others. So that's why I think that meeting with a genetic counselor might help you guys make what's the decision for you guys, because it's a lot of money to get genetic testing, and if you think it's worth it, then that's your choice. And a lot of other people end up just looking at their physical signs and symptoms and family history to figure out if they should keep an eye on their issues as if it were Marfan syndrome.
Okay.
Mm-hmm.
How common is Marfan syndrome?
Well, it's relatively common. 1 in 5,000 births result in Marfan syndrome, so it's not, super common, but it's not completely uncommon. So, yeah. Do you have any other questions that you'd like to ask me?
Not yet. I'm just thinking for a minute.
Okay. You just go right ahead. Take your time.
Thanks. I feel totally alone in this.
Mm-hmm.
I've never heard of anyone that has had this, and I don't know where I could even find other people to relate to.
Yeah, no, I understand that. I understand that it's definitely hard to hear that you might have something that you've never really heard of. There's a lot of different community outreach programs. There's actually one right in Augusta, Maine that's new, and I can give you some more information on it. It's just a group of people that are either family members or have Marfan syndrome, and they meet once a week, so I could set you up with that. And there's also a Marfan Syndrome Foundation, and they have a lot of resources online and a blog even that you can connect with other people that, all over the U.S., and they have a lot of helpful information, if you're concerned about health insurance and how that might cover, treatments and different diagnostic procedures. They can help you identify different doctors in the area that specialize in the treatment and, just progression of Marfan syndrome. So I can give you that information if you'd like.
Yeah, I would like that. That would be helpful.
Okay, well, I hope that would help you feel a little bit more comfortable, with this, and then we can set you up with a genetic counselor. So have you ever thought about why maybe you may have Marfan syndrome? Is there anything that you've looked up that maybe you think resembles the different signs and symptoms?
Yeah, well, when I Googled it, they showed just, things that you can do to see if you're at risk, which was, with the hands, if you, can bend this back, or, I feel like my arms and legs are just really long, and that seems to be a symptom or characteristic.
Right. Yeah, I think that, so there are a few different signs and symptoms that people kind of look out for that they can on their own, and you just definitely mentioned a few. If your wingspan is longer than you are tall, and none of these actually mean you have Marfan syndrome, but it's just to keep a lookout because early intervention is really the best strategy. And there's also some loose joints, if you can feel your joints being loose. Long fingers that are hyperflexible, like you said.
Yeah.
And some spinal curvatures, like if somebody had scoliosis, that could be a sign of Marfan syndrome. Some chest deformities, either, coming out or
my brother has that.
Your brother has that?
A lot.
And did you ever think that, think about how you all may have different signs and symptoms and how that...
Well, my brother, obviously, is the most at risk for having it for all the heart things that he had.
Mm-hmm.
And he has really long fingers. He's tall and thin, but he doesn't have, like, the flexibility that I do. So I don't know why I would have that and he doesn't.
Right, yeah. No, that's Marfan syndrome, it's really variable in the way it presents itself.
Mm-hmm.
You know, somebody could have a heart condition, the aortic enlargement, and have no physical signs and symptoms that we just described. Or you could have all of the physical signs and symptoms that we described and not have any of the heart conditions.
Okay.
So it's definitely common for, even just within a family, there being a huge variability in the way that it presents itself.
Mm-hmm.
Which also could mean that, you know, somewhere along the line in your family, if there's been any deaths related to heart conditions, it could very well have been from, you know, the condition or the Marfan syndrome that we're describing without them having known.
Or it could have been another connective tissue disorder.
Right. And it could be really any of it. And that's why we need to, you know, connect with your family and see if they'd be willing to come in and talk to the genetic counselor to figure out what's best for you guys. And if they're not necessarily willing to come in, we could still set up for you, you know, having your heart, eyes, and your lungs and other, you know, joints checked on a regular basis, because keeping track of this, you can really have a full life with Marfan syndrome. You just have to keep track of all of these different organs to make sure that nothing is happening that you don't want to happen, and if there is, then to treat it as early as possible.
Okay.
Mm-hmm.
So you'll refer me to a genetic counselor?
I will, and I'll also make sure to stay in touch with you guys to make sure you're getting all of the information that you need, and I can connect you with the support group in Augusta.
That would be great.
And then give you some of the information on the Marfan Foundation so that you can connect with a doctor in the area, as well as figuring out, you know, how your health insurance might be involved in covering some of these annual procedures just to check in on your heart and stuff. Because it can get expensive, which is, you know, hard for people.
And I'm just a student right now, so I don't have a lot of money.
Right. And you know what? That is totally fine. I think that we can try to, you know, set you up as well as we can. Is there any other concerns that you have? How do you feel about this right now? It's kind of a lot of information to take in.
It's a little overwhelming,
Mm-hmm.
but it feels good to know that I'll be able to speak to a genetic counselor, and I feel a little better just knowing that,
Mm-hmm.
just having more information about it.
Right.
So
right.
Thank you.
You're welcome. And do you have, you know, like, you can talk to your family, right? They're all open to this idea of getting the testing, and
I'll have to discuss it with them. I don't think that they'd be completely opposed to it, but
mm-hmm.
I'll have to have that discussion.
All right. And if they want to contact me or, you know, the genetic counselor, or any of the doctors that we set you up with, then they can feel free to open that up to them as well.
Okay.
Okay. Well, it was really nice to meet you, Holly.
It was great to talk to you. Thank you.
Thank you.